This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together. This video will be presented in 10 sections. Section 1, Introduction. Section 2, How to get started. Section 3, Hand hygiene. Section 4, Prepare a clean workspace. Section 5, Gather supplies. Section 6, Prepare supplies. Section 7, Disconnect and unload the pump. Section 8, Flush the line. Section 9, Load the pump. Section 10, Ready to connect. Section 1, Introduction. You have been prescribed an IV medication that you can safely take in your home. The procedure and steps to follow will be provided in this video. This video is written as if you have been sent home from a hospital or clinic with an electronic pump already attached. Your medication is infused using an electronic pump and remains connected to you for up to 24 hours a day. This video will provide you with instructions on how to change your medication bag when needed. The pump used in this video may be different from your pump. Please ask your nurse or pharmacist for specific instructions on the type of pump you are using. Additionally, any special instructions based on your drug will be provided by your nurse or pharmacist. Please watch this video as many times as you need. If you have a caregiver, family member, or a friend helping you, please have them watch it as well. Section 2, How to get started. Your nurse will tell you how to store your infusion medication. Your nurse will tell you when to take your medication and how often. Your pharmacist or nurse will tell you how long each bag should run before it's time to change it again. You should change the bag at the same time of the day on the days you are due to change the bag. You will need to take the medication out of the refrigerator in advance. Your home health nurse will tell you how far in advance you should take the medication out. Section 3, Hand hygiene. Now, let's talk about the most important step, hand hygiene. Practice good hand washing. Washing your hands helps reduce your chance of infection. Use soap and water at first. Make it a habit to wet your hands. Apply soap until lathered, and then scrub your hands for at least 20 seconds. To make sure you are taking 20 seconds, sing the Happy Birthday song twice. Then dry with a clean paper towel. You can use hand sanitizer after you've already washed your hands with soap and water. If you use hand sanitizer provided by your healthcare team, rub a nickel-sized amount between all parts of your hands using friction for at least 20 seconds until they are dry. Never wave or blow on your hands to speed up drying. Even if you are using gloves, you must still wash your hands. If your nurse tells you to use gloves, put your gloves on after washing your hands. Section 4, Prepare a clean workspace. Now it's time to prepare a clean workspace. Before each infusion, find a clean, dry, hard work surface to set up your medication and supplies. If your nurse gave you a SAS or SASH placemat, put this mat on top of the work surface. Clean the workspace, including the SAS or SASH mat, with a gentle cleaning solution, such as a disinfectant spray, or with alcohol pads. If you do not have a SAS or SASH mat, use the clean surface and place all supplies in the approximate locations we will show you later in this video. Wash your hands like you did before. Section 5, Gather supplies. Your home infusion agency will provide you with these supplies. If you are missing any supplies, contact your home infusion agency. You will need 1 saline syringe to flush the line, 1 bag with medicine and IV tubing, 4 to 5 alcohol pads to clean your supplies and hub or IV line tip, 1 electronic pump, 1 carrier pouch to carry your pump and bag, 1 trash bag such as a small grocery bag, 1 sharps container. Double check your medication. Compare the information on the bag to your orders and make sure it is the same. Does the medication have your name and date of birth? Is the medication name correct? Is the medication amount correct? Is the medication expired? If any of this information is wrong or the medication is expired, stop. Do not start the infusion. Call your home infusion pharmacist immediately. Arrange your supplies on your clean SAS or SASH mat according to the steps. Place the alcohol pads in their place on the board. Place a saline syringe over the first S. Place your medication bag over the A. Now, wash your hands as you did before. Section 6. Prepare supplies. Start with a saline syringe. It looks like this. Remove the saline syringe from the plastic wrapper. Place the syringe on the SAS or SASH mat under or by the first S. Place an alcohol pad on the SAS or SASH mat. If your medication bag is in a plastic bag, remove it from the plastic bag. Place the unwrapped medication bag above the A of your mat. Locate the tubing and remove it from the wrapping. Remove the white tape and the blue clip from the tubing. Move the clear plastic wrapping to the side. Place the carrying bag to the side. Place the trash bag close by and the sharps container within your reach. Your mat is all set. Wash your hands as you did before. Section 7. Disconnecting and unloading the pump. Ask your nurse or pharmacist how to use your pump. We will go over a few basic steps that you will need for many different pumps. This type of pump is a CADD pump. Follow your nurse's or pharmacist's instructions about how to stop the pump if it is still infusing and how to turn off the pump. Remove the pump and the old empty bag of medication from the pouch and place it on the work surface. Now, unhook the old medication tubing from your IV line. Hold the end cap or hub of the IV line with one hand. Use the other hand to unscrew the medication tubing. Do this until it is disconnected from the hub. Be sure not to remove the end cap or hub from your IV line. The end cap is very important because it is what protects your IV line from bacteria. Remove the medication tubing and bag from the pump. Follow your nurse's or pharmacist's instructions about how to do this. Lift the tubing from the pump and discard in the trash. Wash your hands like you did before. Section 8. Flush the line. First, wash your hands. Now, you will pulse flush the IV line with saline. Some providers may have you use heparin also. First, you will need to get rid of the air bubbles in the saline syringe. Loosen the syringe cap, but do not take it off of the syringe. Hold the syringe with the end up and the plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out without pushing off the syringe cap. Tighten the cap back on the syringe. Once the air is removed, you are ready to flush the IV line with saline. Keep holding onto the syringe. Next, clean the end cap on your IV line. Keeping it clean will prevent infection. We call the piece you will clean the hub. You will now scrub the hub of your IV line. Use the alcohol prep prior to the S. Remove the outer wrapping to expose the alcohol square. Hold the end cap between your fingers and scrub the hub, which is the tip of the end cap, for 15 seconds with an alcohol pad. Get all sides of the hub as well as the tip. Do not put down the hub. Discard the alcohol pad. Once you have scrubbed the hub, you do not want to get it dirty by allowing it to sit on a surface or hang loose. But if you do, it is okay. You will just need to re-clean again with a new alcohol pad. While keeping the hub clean in one hand and the saline syringe in the other hand, attach the syringe to the end cap of the IV line by uncapping and screwing the syringe to the hub in a pushing-turning motion, like putting a key in an ignition. Now you will pulse flush with saline. Slowly push about 1 to 2 milliliters of the saline in at a time. Stop and push 1 to 2 milliliters more. Stop and push in a little bit more. Keep doing this until the syringe is empty. Flushing this way each time helps keep your IV line from getting clogged. If you are unable to flush your line or find that it takes a lot of effort to push in the fluid from the syringe, double check to make sure that the clamp on your IV line is open. If your clamp is open and you still have difficulty, stop and call your infusion provider. Once you have emptied the syringe, disconnect the empty syringe from your IV line and throw it away. Remember, you do not want to remove the hub from your IV line. Section 9. Load the pump. If you will not be off of your pump and you have just flushed the line, you will now load the new pump. If you have been off of your pump for an hour or more, scrub and pulse flush your line with saline like you did before. Place your new medication bag with the attached tubing next to the pump. Load the tubing into the pump based on your nurse's or pharmacist's instructions. You may need to spike the bag or prime the pump based on your nurse's or pharmacist's instructions. Once the medicine is dripping out the end, you are primed. Make sure all clamps are open. Turn on the pump. Follow your nurse's or pharmacist's instructions about how to turn on the pump. Section 10. Ready to connect. Wash your hands as you did before. To connect the IV tubing, you must again scrub the hub for at least 15 seconds. Use the alcohol pad in front of the A this time. Wrap the square around and over the hub and apply friction, just the same way we did before. Remember, we call this scrubbing the hub. When you are done, throw away the used alcohol pad. Keep holding the hub in one hand and do not let it touch anything. With your other hand, locate the end of the IV tubing. Attach the tubing to your IV line by pushing and twisting as you screw the IV tubing onto the hub. Once connected, check all clamps one last time to ensure they are all open. Start your infusion using the pump based on the instructions from your nurse or pharmacist. If your pump alarms, read what the screen is saying. You may need to recheck to make sure all clamps are open. Check the tubing for kinks as well. If you get an alarm and are unsure what to do, please call your infusion pharmacist immediately. Place the pump back in your pouch and go on with your day. You have now started your pump. If you have any problems with your infusion, call your home infusion provider.